Lots of you called in with questions for our guest tonight, Dr. David Aronoff from Vanderbilt University Medical Center. We have limited time tonight as we get into the second half, so I want to make sure that we get as many questions as we can. Let's bring in Warren. Warren, what is your question or comment tonight? Warren, are you still with us? Warren, give you one more chance. Warren, are you still with us? Okay, let's try Lily. Lily, how are you tonight?
Yeah, hello. This is Warren.
Oh, Warren. Okay, we got you, Warren. Okay, I may have pressed the wrong button. I apologize.
Very good. All right, no problem. Actually, 2 points and questions. In the case of Michigan, the last figures I saw, doctor, that for the last 7 weeks running, the center of infections are the schools, and the premature opening of schools. And the other question is, you know, unless we talk about Tennessee, we talk about the nation, but unless we kill this virus on a world scale, there is no salvation. I mean, we can vaccinate everybody in America, but unless we vaccinate everybody in the world, we can't build walls high enough to prevent being reinfected. And I'll take my answers offline. Thank you very much.
Warren, great point there, because, you know, as this virus showed, we are a global society and the virus doesn't know a border. So I think that's a great question and comment there, Warren. Dr. Aronoff?
Yeah, Warren, thank you very much for both those comments. I appreciate your insight on the Michigan situation. And also, you're exactly right. This is a global pandemic, and I certainly hope that we and other countries that have the ability to make and distribute vaccines are part of the solution and able to collaborate and cooperate to get people immunized worldwide. Now, by getting people immunized in our city, in our state, in our country, we are going to save lives, even when the pandemic rages on in other corners in the world. But you're exactly right. The secret to ending this global pandemic is through global immunization, and I'm glad that you brought up that point.
All right, let's move right along. Now we're ready for Lily. Lily, go ahead.
Yes. Hello?
Hi there, Lily. Go ahead with your comment or question.
Okay, I received the Johnson & Johnson on Friday, and I'm having my left arm is stiff and my right leg is kind of stiff, and I'm having my blood pressure is low and extremely low. Should I be concerned or I need to go to the emergency room? And then also, what are the other symptoms that I should be looking for? And I hang up and listen.
Great, Lily. Thank you very much. I mean, certainly having a sore arm is normal with these vaccines, and that can last longer than a week. It generally gets a little bit better every day. If you're having problems like low blood pressure or new pain in your leg, particularly if that pain is associated with swelling or is getting worse and not getting better, that may be something that you want to have checked out. And while it may not at all be related to one of these severe blood clots that we've heard about in the news, it may be something else. And so it's always good to check in with a licensed healthcare professional. If there's someone in your life, if you see a regular physician or nurse practitioner, to give them a call tomorrow and talk with them. Of course, if symptoms or blood pressure gets worse or worrisome, you can always go to a local emergency department. The kinds of symptoms that we are really seeing people from the CDC and others saying we should be alert about in terms of the J&J vaccine would be something like a brand new severe headache or blurred vision, fainting, seizures, loss of consciousness, severe leg pain and swelling, shortness of breath, chest pain. Those would be things that you should go to the local emergency department for. Low blood pressure has not been part of this, but certainly if your blood pressure is lower than it normally is, if it's dangerously low or it's associated with lightheadedness or feeling faint, that may be something you need to have attended to for a host of reasons. And so reporting to urgent care or emergency care or checking in with your licensed healthcare professional is the way to go. Thank you very much for calling.
I'm so glad Lily asked that, because that just once again gives us the opportunity to kind of put out there, okay, this is something that maybe you should keep an eye on, and this is something that is pretty routine when it comes to these vaccines. Franklin is on the line with us as well. Franklin, go ahead.
Yes, thanks for taking the call. Dr. Aronoff, got the shot last week, the second shot. A few days later, I got real dizzy up here at Kroger's the other day and stumbled backwards while I'm in line. But I'm trying to prove to my young boys. I got 4 sons and 1 daughter. There's nothing wrong with getting this shot. It's hard for the black generation, old and young, to convince them to take this shot. They've been reading so much stuff online. I'm going to be sterile, Dad. I won't do this, do that. I'm going to be in bad shape. Well, you dead and gone. What am I supposed to do? So it angered me. But the leaders in this country have let people down, and you're not talking about that. The leaders in this country, the governor, took his in private, and Trump and all those took his stuff in private. So therefore, people are paranoid. And then it goes back to the 40s and 30s, the experimental thing. Now, I don't mind them taking these shots, but me, I took a chance. I took a chance to show if I could do it, son, you can get out there and no problem. But now I'm angry because the local government started opening all this stuff up, and we ain't even sure what's going on.
Franklin, thanks so much for your call. You bring up lots of great points, and Franklin's right. Governor Lee has told members of the media that he has gotten vaccinated, but did not do a picture. Same thing with Senator Marsha Blackburn from Tennessee, and he brings up the former President Donald Trump, and he also has told members of the media that he's been vaccinated, but did not take a picture and kind of take advantage of an opportunity to share that with the wider audience. Lots to touch on there from Franklin's call, Dr. Aronoff.
Yeah, Franklin, first of all, thank you for calling. And second of all, thank you for getting vaccinated and demonstrating that leadership, not only for everybody who just heard you say that, but also for your family. And that's really, really important. I think that all of us need to be vocal about the fact that we got vaccinated. I got vaccinated relatively early because I'm a healthcare provider and had that opportunity and have been helping in the care of our patients with COVID-19. And I'm the first to tell people when I got my second shot, I felt bad the second day. I had to take ibuprofen. I was pretty useless, but then I was fine. And if that's what it means for me to be protected from getting sick from COVID-19 and also protecting you and others from COVID-19, then that day of being somewhat out of play was completely useful and important for ending this pandemic. But you're exactly right. There's lots of work we need to do in the medical community to engender trust. A lot of that is tied into issues around systemic racism and other historic and current problems that are challenges to getting people to trust us when we bring out something that we think and know is safe and effective and important for ending this pandemic. So thank you so much for calling, Franklin, and hopefully this kind of conversation from you and demonstrating your leadership will help others step up and get vaccinated.
And thank you for that, Dr. Aronoff. We have to take a quick break, but we'll be back after this.